questions do y'all have? So I want to get a feel for what your level of knowledge is and what you're interested in. So, because I can talk all night, okay? And basically, I promise to talk for, not talk the whole time, but we'll go until 7 o'clock, and then if other people have questions, people can say afterwards. But let me get a feel for where you are and what you want to know. Yes?
I've been going through menopause with hot flashes for 22 years, and I'm tired of it. I can't take hormones, so I'm what I cool, and it may or may not work.
Okay, you've got what?
iCool.
iCool? I don't know
It's
that.
supposed to be, it's off the counter in the store. It's supposed to help you with the hot flashes. And sometimes it seems to work, but
Okay.
yeah.
All right, cool. Other questions?
What you talked about yesterday, with magnesium glycinate, and how to go about using it. I never knew how much to use.
Okay.
I buy a product called Calm.
Isn't it wonderful?
Well, it hadn't really lowered my blood pressure like I thought it would.
Okay, okay, all right, we'll come
I
back to
don't know if
that.
I'm getting enough medication.
Okay, all right. Calm, it has ionic magnesium in it. So if you take too much at one time, and this is true of all magnesiums, but if you take too much of ionic magnesium at one time, it'll give you the squirts. So you have to, if you're trying to control blood pressure, you would have to take it several times throughout the day. Just taking it one time throughout the day ain't gonna cut it. It's just
Well,
not.
take it once.
No, it's not gonna work. It's not gonna work.
What's the best way to do it with
No, that's
magnesium
one
glycinate?
question, one question. I'll come back to you. I'll come back to you. Other questions? Yes, ma'am.
Anything thyroid related.
Okay, all right, so supplements have to do with thyroid.
Well, I had my thyroid removed, and so I take medication, but I still have all kinds of unresolved issues.
Okay, all right. Other questions? This is very different from what I was expecting, so I'm glad I asked the questions. Nice to see you. You came back again. Rebounded very quickly. Yes, yes.
Acid reflux and Nexium and that kind of stuff, does it increase, will it do your blood pressure, make you have a higher blood pressure?
Yes, it can. Yeah, and I'll explain the reason. Let me start. Okay, other questions? You will get to ask questions again. Let me start with yours. Okay. One of the most important things that I do for people the very first time I see them is to figure out, do they have enough stomach acid or not? And the way I do it is I have them go over and see Catherine, who's in the back. Catherine runs my supplement store for me. And we give people a little package of betaine hydrochloride. Betaine hydrochloride is a way of getting stomach acid into your stomach, okay? So where I go differently from a conventional doctor is going to say, oh, you get indigestion, oh, you get heartburn after you eat. Let's get rid of that really bad stomach acid because you're going to get Barrett's esophagus and you'll get esophageal cancer, okay? And it's uncomfortable. And you might get a runny nose from it, and you might get asthma from it. I'm not trivializing acid reflux, okay? It's a very real problem. And so what they will do is they will give you the purple pill or the pink pill or whatever it is that is a PPI, a proton pump inhibitor. And those drugs are very, very potent. They squash your production of stomach acid. Now, what you need to know is that, and this is a little bit of a sideline, but most drugs are blockers. They block some process in your system. So cholesterol drugs, the statin drugs, for example, they block the enzyme that, the rate-limiting enzyme that helps you make cholesterol. So they block that so you make less cholesterol. But, oh, CoQ10 is downstream from that too, so you don't make as much CoQ10. Oh, selenium-containing enzymes need some of these other molecules down here. And so that you don't make as many of those, so you get hypothyroid. Being on a statin drug, not everybody, but some people do. So what happens when you take a PPI is that it goes down, it goes through your stomach, into your liver, comes back out on the back side of your stomach, and it blocks the cells that produce stomach acid. The body does not like having things blocked. You know, I don't know if you saw, you know, if you have high blood pressure, maybe the drug will work for a little while, and then it'll lose its effectiveness. Our bodies are so smart, it likes to get around that. Okay? So what happens with the PPIs is that the body tries to get around that drug by producing more acid-producing cells, more acid factories. So if you try to come off of that PPI, if you try to come off of that Nexium, your heartburn will be even worse than it was before. Have you tried that?
Yeah.
Yeah, it's terrible. You have to stay on it. That's a really good drug, don't you think? I mean, I'd buy stock in that company. You're going to be on that stuff forever. So people get discouraged and just decide to stay on the drugs. And what you do when you try to come off of those drugs is you taper off very slowly. You cut back and you cut back. And the way that I have people taper off of high blood pressure medicines or PPIs or antidepressants, anything like that, is I say, take a whole pill one day and a half pill the next day, and a whole pill and a half pill, and a whole pill and a half pill for 2 weeks. Then take a half for 2 weeks. Then I take a half, nothing for 2 weeks. And then cut back on it even more. That way, the body has a chance to respond to it. Especially if you're on anything that has activity in your brain. Your brain does not like anything to change real quickly. So you have to come off of any kind of antidepressant. I mean, benzos, you know, Xanax and lorazepam and things like that, you have to come off over 6 to 9 months. Okay, those are very, very addicting. But back to the PPIs. So what do you do to help your stomach work better? What I do, and I will do this if I've got someone who's on a PPI, I will start giving them stomach acid in the form of the betaine hydrochloride, okay? Because what the stomach acid does is it helps the muscle at the bottom of your swallowing tube tighten up. So, and it also helps to open up the muscle at the bottom of your stomach so that food can go ahead and move on through. So many people who have reflux, that sphincter, that lower esophageal sphincter at the bottom of the esophagus doesn't work real well because you're not producing as much stomach acid as you used to. And a little bit of stomach acid, just a little bit that sprays back up in your esophagus really hurts your esophagus. Your esophagus does not like stomach acid.
Mine narrowed down.
Okay, because you've had it for such a long period of time. So what I do is I give people stomach acid, and that tightens down the muscle. Now, may not apply to you because your lower esophageal sphincter might be destroyed. Okay, because you've had so much reflux for a long period of time. If you are really fat and have a great big belly, then that's going to make things kind of pooch back up through there, and that lower esophageal sphincter may not work. So what I'm saying doesn't work for everybody, but the majority of people that I see don't make enough stomach acid. And the way I find out is I give them a little bit of stomach acid that they can take with each meal. And if they don't get any heartburn, if they don't get any discomfort, if they don't get any warmth or nausea in the pit of their stomach, they actually need more stomach acid as opposed to less. Does that make sense? When you take a PPI, you don't stop reflux. You actually reflux more because that lower esophageal sphincter doesn't close at all. Okay, and because you don't have any stomach acid to close it off. And so you're refluxing even more, but it's not acidic, so it doesn't hurt the tissues and doesn't cause as many symptoms. And I'll have people take the betaine and take 1 pill with each meal and see how they do with that. If they don't have any discomfort in the pit of their stomach, then I have them take 2 with each meal. Then I have them take 3 with each meal. Then I have them take 4 with each meal. Most people don't need more than 7, but I take 4 of those stomach acids with every single meal. Now, people who have type A blood, well, let me back up. Everybody has a reduced ability to produce stomach acid as we get older. How many little old ladies are here, or you know little old ladies, who have a little bit of vinegar with their meals? Haven't you heard that as an old wives' tale? Yes? Yeah? They know what they're doing. They need the acid. You can take lemon juice. You can take vinegar. But that's why they're reaching for that, because it helps my digestion. They are absolutely right. Now, what happens if you don't have enough stomach acid? Because you're on a PPI, or because you've had too many birthdays? And one thing about blood types, I've got type A blood, okay? Type A's, it ends up, lose the ability to make stomach acid earlier in life than all the other blood types. Okay? And all of us, as we get older, lose that ability to make enough stomach acid. So if your hair starts turning white in your 20s, okay, start getting gray hair in your 20s, all right, you need stomach acid. You don't need hair dye, you need stomach acid. And probably some other supplements too. But you don't have the stomach acid to help you absorb the different nutrients. You don't have the stomach acid not only to help absorb the nutrients, but also to break down the proteins into the amino acids that give you hair color. Okay? So, what don't you absorb if you take a PPI? B12, folic acid. So your brain doesn't work as well as it used to, and you may have a peripheral neuropathy, and your balance may be off a little bit, and you may be a bit depressed and a bit anxious. Zinc, selenium, that's going to cause thyroid problems. If you don't have enough zinc, if you don't have enough selenium, that will make you hypothyroid, even if your thyroid hormones are all within normal range, even if you do all the thyroid hormone tests that I do on you, which is a lot more extensive than what most conventional doctors do. All right? What else? Calcium, magnesium. Okay, now, is that going to contribute to high blood pressure in a lot of people? You bet it is. Is it going to contribute to accelerated osteoporosis, especially in women when we go through menopause and we don't have the hormones there to help protect our bone? You bet it is. Iron. Okay, if you're chronically tired and chronically anemic, and you just, you can't, and you take some iron. Anybody who takes iron and it just tears up my stomach, I can't take that stuff. And I won't eat liver, Dr. Vaughan. If I give them stomach acid, then it doesn't hurt their stomach. If iron just sits there in your stomach, it's going to irritate your stomach. But if you take some stomach acid or some lemon juice or some folic acid or some ascorbic acid, which is vitamin C, if you take some kind of acid with the iron, with the nutrient that is dependent on stomach acid to get absorbed, the iron won't hurt your stomach. Does that make sense? Okay, stomach acid is your friend, without any question at all. What else happens when you don't have enough stomach acid? You have a greater risk of getting candida, greater risk of having an imbalance in the healthy germs down in your gut. And I talked a little bit about the critical importance of having healthy germs in your gut in that article. Tina Airy, stand up, Tina Airy. Stand up, oh, come on. She just loves being pointed out. Tina is an RN. She used to work at Baptist. She worked both at the student health center. She's also an ICU nurse. Okay, she knows her stuff, and she is helping write those articles. And she's working on one right now about probiotics, and it may be a 2-month article because it's so complicated. But the bottom line is you need that stomach acid to kill off germs that you don't want down your gut and to promote healthy germs in your gut and to keep you from getting yeast. If you don't have enough stomach acid, you have a much greater risk of getting yeast. Okay, what else does stomach acid do for you? It helps you break down your proteins. If you don't have stomach acid, then proteins in food are what cause food allergies, food sensitivities. It's what contributes to your having a leaky gut. So if you have irritable bowel symptoms, you might try taking some stomach acid every time you eat. Test yourself the way I just described. Catherine can help you and give you some advice on how to do that if you don't remember what I just said. You might find that, gee whiz, that helps take care of your irritable bowel. Okay? The problem with your hair is that if you don't break your proteins down into onesies and twosies of amino acids, okay, then your bodies may start reacting to it and making antibodies against it. How many people here know someone who's sensitive to gluten? Someone who's sensitive to wheat? Okay? All right? If you better digest it, you know why we get sensitive to gluten? It's because we can't break the stuff down. And if you don't have stomach acid, you really can't break it down. And casein that is in milk is, if gluten looks like this, casein looks like this. They're very, very similar. So if you're sensitive to gluten, you probably are sensitive to casein. You need to be off of both of them, at least for a while. But one of the problems is that most people don't have enough stomach acid who get sensitive to casein and gluten, and they can't break it down. So using stomach acid will help you not have as many food sensitivities. I'm not saying reintroduce gluten. Okay, I'm not saying that. Because once you have a sensitivity, it changes. But to reduce your risk of developing those sensitivities, you have to have enough stomach acid. All right? You never thought you'd learn so much about stomach acid, did you?
Would it affect your, like, AFib or anything, or what it
Your
causes?
what?
I said it deplete those other, minerals, like with Nexium and stuff.
Mhm.
Could it have effect on, like, causing heart in AFib or anything?
Absolutely, because if you don't have enough magnesium, that will cause atrial fibrillation. It can even cause heart block, which is exactly the opposite of what you would think. It can cause palpitations. If you don't have enough magnesium, you can get high blood pressure. You can get, I'll kind of run through that, what I said yesterday morning. It can cause hypertension. It can, magnesium deficiency, hypertension, chocolate cravings. Watch for chocolate cravings. I'm going to go back. Someone say satiety in a minute. Remind me about satiety. But magnesium deficiency can cause muscle cramping, muscle tightness, restless legs at night where you have to move your legs. It can cause constipation, headaches if you don't have enough, irregular heartbeat, wheeziness. I mean, how many people kind of wheeze when you cough? Okay, that's because I don't have enough magnesium in my chest right now. I need more magnesium than I have. And one of the reasons I was harping on magnesium was because I started doing a much better test for magnesium, which is a magnesium RBC, and all of you should write that down. And all of you, if you have any symptoms of magnesium deficiency, you should march into your doctor's office and say, I want a magnesium RBC. Okay? It's a red blood cell magnesium. So you are testing the magnesium level inside a tissue. That tissue is your red blood cells. Where does magnesium hang out in our body? It's primarily inside the cells. So what I had been depending on was the serum magnesium, which is what everybody gets. And I knew that I could get an RBC magnesium, but it was kind of expensive, and I didn't want to keep patients' costs and stuff like that, and so I didn't do it. I was wrong. I have gotten about 60 people's red blood cell magnesiums since doing more research on it. And only 4 people have been in normal range. 4. These are all established patients of mine. I am underserving them. I was so embarrassed, and it was just, oh my goodness. And people started coming back and saying, you know, I don't need some of those other supplements that you put me on. I'm real calm. Now that I've got that magnesium on board. I'm just amazingly calm. I'm grounded. My blood pressure's a whole lot better since I took all of that magnesium. I am sleeping so well on the magnesium. All that chocolate cravings I had, they're gone. Remember those tight muscles? How my muscles used to be so tight up here? It's not there anymore. And all I did was push the dose of magnesium. Now when you start pushing the dose of magnesium, you cannot take it all at one time. You know, everybody says, I have patients, I can only take my supplements once a day, little lady. I take them with breakfast in the morning. That's it. I can't remember them at night. I just take them in the morning. Well, then that's going to work for somewhere between 4 and 6 hours, and that's going to be it. The rest of the time, he's on his own. Okay? Because what does your body do? Your body takes what it needs from this smorgasbord of nutrients that you hopefully took with some stomach acid, or some lemon juice, or some vinegar. Hopefully you took it with food on your stomach, okay? And so you absorb them. You didn't just poop them out. And your body chooses what it wants, and then you pee out the rest. Now don't tell me, well, all I'm doing is making expensive urine. I'm wasting it. No, your body picks what it needs, and it gets rid of the rest. If your urine turns yellow after you take a B complex, it's because you have absorbed lots of that B complex. And your cells have taken it up. And you're just peeing out the leftovers. So you have to take supplements several times a day. You just have to. Minerals and B vitamins, they are in and out of your system pretty quickly. Now, I can also say it takes about 24 hours when you take a mineral for it to get all the way into the cells that it's going to get into.